Food Allergy Forum. The meeting is now being recorded, so you are aware of that. And secondly, if you attended the Food Allergy Forum recently, a few weeks ago in Amsterdam, some of the content of this will be familiar to you. This webinar was set up principally with the intention of continuing to reach a wider audience. But also, if you were at that meeting in Amsterdam, what we have today is a more extensive Q&A session. So at least half of this meeting today is a Q&A session. So if there were questions that weren't answered during the Amsterdam meeting, or there's follow-up questions, even if you were at Amsterdam, it's possible that there will be hopefully some value for you in this meeting. So, okay, so joining me are other eminent experts from the expert group that we had in ILSI, and that's Rennie Cravell and Simon Flanagan. So Rennie and Simon will give a couple of presentations to give a fairly high-level overview of the guidance document before we get into the Q&A session. And then within the Q&A session, we will have a wider panel of experts who were involved in coordinating the development of the guidance document. So we have quite a lot of input available to answer questions in that session. So once again, the focus of this webinar is this guidance document, which is available on this ILSI webpage. So if you haven't yet been to that webpage and downloaded this document, and it's free to download, then we'd direct you to do that. And also on that webpage, there are some supporting materials, such as, for example, a calculation tool to help you work through the process, the nitty-gritty of doing a calculation of quantitative risk assessment. But it's important to say, although we are talking principally around this guidance document today, the way we view it is that this is just, as it were, a seed around which to crystallize the wider food industry in terms of an aligned understanding of when it's appropriate and possible to use quantitative risk assessment as an addition to established allergen management practices. And when it is appropriate and possible, the details of how actually to perform it, so the sorts of assumptions that are important to take and how to take them, and also, of course, how to do the sorts of calculations and how to interpret the information you get from that assessment. So this is a way of crystallizing our common understanding of this technique and how and when it can be applied. And principally, the purpose, of course, is to provide information into the decision-making that we all have in terms of when it may be appropriate and perhaps not appropriate to apply precautionary allergen labeling, so-called may-contain labeling. So what I'll do is speak briefly about ILSI Europe. So that's the organization which managed the expert group to put together the guidance document. And then we'll get into the real core of it, which is the presentations from René, and also what we call the core concepts, the underpinnings of quantitative risk assessment, which Simon will speak to. And then we have the Q&A session. And then we'll talk a little bit about next steps. And one of the important next steps is that I hope you saw that on LinkedIn, we've established a community of practice, and I'll speak to that a little bit after we've had the Q&A session. Okay, so ILSI. So ILSI works on scientific issues impacting the food industry. The purpose of ILSI, the mission is to foster collaboration and essentially facilitate consensus building on scientific issues of the day, problems related to the scientific underpinnings of nutrition and food safety. And ILSI brings together three different types of stakeholder. Of course, there's ourselves for industry, and then there are academics as well as governmental agencies. So these are a list of the industry members currently active in ILSI. And this is the high-level structure of how ILSI works. So within the organization, there is a leadership structure, of course, and importantly, that leadership structure in terms of the operations of what we do within ILSI is composed of an executive director and her staff, which are the excellent scientific project managers who really, make sure we stay on track and also give important input into the projects that we're involved in. So we have clusters within ILSI. We have the safety cluster and the nutrition cluster. And sitting underneath those clusters, we have task forces. And within the safety cluster, one of those task forces that has been in operation for more than 20 years now is the Food Allergy Task Force. And the Food Allergy Task Force, due in no small part to some of the people who will speak today, has been really influential in moving forward how allergen risk assessment is done, and including all aspects, analytical testing and the derivation of reference doses, etc. So one of the current activities of that Food Allergy Task Force is this expert group, one of the outputs of which is this guidance document now, which we're speaking about. These are the current members of the Food Allergy Task Force. So we have 5 industry members. We have an academic member involved in the University of Nebraska-Lincoln, and also we have a government agency that's a member. And of course, the expert groups you can recruit not just from the task force members, but whichever experts, particularly academic experts, are relevant for that particular expert group, which is managed by the task force. And at any point in time, there tends to be 3 or so projects on the go. So this is a fairly complicated slide, and I have to say that is purposeful to some degree because it displays the complexity of this project that we're talking about now. So the project to develop this first version of the guidance document on QRA implementation has been through a 2-year process. And because we really wanted this guidance document to be as far as possible a consensus amongst all the key stakeholders, we had a much wider stakeholder group that was involved in this activity. Renee will speak to it in the next presentation, but essentially we went through many, many different meetings, workshops to gain consensus on different aspects of the document. And preceding this, of course, was 20 years of development of allergen risk assessment and the underlying principles, such as the derivation of reference doses, that the Allergy Task Force has been very much involved in. So I'll just introduce both speakers before we get into it. So we have René Crevel first. So René operates his own consultancy business, previously spent bulk of his career at Unilever, where he was really responsible for allergen risk assessment and all aspects of risk management. And is recognized not just from a practical perspective in terms of managing allergens in production sites, but also from an academic perspective in terms of understanding the risks associated with allergens, from the perspective that he holds appointments not just at the University of Manchester, but also at Nebraska-Lincoln, so the FARP organization, if you're aware of that. René's also been involved in the UK's Food Committee on Toxicity, and also in the very recent FAA WHO expert consultation to advise Codex. And then there is Simon Flanagan, who is the research fellow and subject matter expert on allergen risk assessment at Mondelez. Again, René's external activities, but beyond his internal Mondelez responsibilities, have led him to really be recognized as a leading expert in the field of allergen test methods as well as risk assessment, and in no small part that is attested to the fact that he's the principal editor of this important tome, the Handbook of Food Allergen Detection. So those are our 2 speakers today. Right. So over to René and Simon, and I will change the control to René, if you're there, René.
All right, okay.
Yeah, thank you. Yeah, I hope everybody can hear me, but I know possibly not. Yes, I hope everybody can hear me. So view options.
We can hear you fine, Rene, just in case you're
Yeah.
wondering.
Yes, yeah, I'm just wondering. I thought I'd got the control, but okay, I can do it from here. Okay, right. Thank you. Oops, that's quick. No, we not. Yeah, thank you, Neil, for this introduction. And I also want to acknowledge that most of this slide set actually is based on the presentation that was given at the Food Allergy Forum by Ben Remington on this particular topic in the ILSI session on the 29th of September. But why this guidance, you might wonder. Well, globally, there's been an increased interest in the integration of quantitative methodology into risk assessment as part of allergen management, but not all risk assessments are the same. And quantitative risk assessment, it seems to be not under my control at the moment. I'm not quite sure why. Can we go back that slide? Sorry, I have to, Neil, I have to ask you. The slides seem to be going automatically.
So according to my screen, Rene, you have control. It says, Rene, oh, I think you have to press a button to take control. It says waiting for Rene to control your screen.
The question is, where is give up? No, that says give up. I've got the give up, but I don't have the.
Okay, let me try again. I'll reinitialize.
Okay.
So stop remote control. Okay.
Yeah.
And then we have remote control, Rene. So you should have a dialog box.
Yeah, well, I have view options at the moment. I don't have a dialog box that I can see.
Does it say at the top you have control?
No, it says you can control Neil's screen, Neil Buck's screen.
Okay.
But it doesn't, I see nowhere where it says take control. No.
Okay, maybe you can.
Unless it's on the, no, it's not, can't be on the custom button. No, it's not that.
Can you try pressing the up button and see if the slide moves?
Sorry, which?
Oh, sorry, the arrow just up or down. Just see if it moves.
Well, that's what I was trying to do before, and it's not moving at the moment. It's gone forward again. In fact, it's gone forward rather than backwards. And yes, maybe I can get it to. Yeah, I can get it to go backwards now. Okay. Right. Sorry about no. Hang on, where have we got to now?
We're getting there.
I'll get it right. Okay. Right, I think. Whoops. No, it's still trying to do.
If you feel more comfortable, Rene, you can ring a bell or something, and I can control it.
Yes. Okay. Yes, okay. Because we don't want to waste people's time. Just me trying to find some control that doesn't.
All right.
Do. So if we could go back to the slide after the after the title slide, so that particular one, yes. Okay, so yes, the third point actually, which I didn't quite get to, was that there's a lack of consensus on the practical deployment of different QRA methods. So if we go to the next slide, please. Okay, right. So what isn't in this particular background, actually, which I think it's important to mention, is actually around about that particular time, we knew that the FAO WHO were actually about to set up an expert consultation on food allergen risk assessment. And we thought this would make a very important contribution to subsequent developments in this area. So an ILSI Europe expert group was established in late 2019 with the first and only in-person meeting at the beginning of February 2020. And the expert group aimed to improve overall implementation of quantitative risk assessment, where applicable and possible, of course, across the food production chain, and to harmonize the reasoning feeding into the decision-making, such as on precautionary allergen labeling, recalls, and so on. And the outputs, which Neil has already mentioned, whoops, that's gone a bit far, are the practical guidance on food allergen quantitative risk assessment. I think also the peer-reviewed publication is missing from that. And the community of practice, which was recently set up to support users of the guidance. And the next slide, please. So just to give you an idea of the magnitude of the project, and it's certainly the largest ILSI project I've been involved in, I don't know about others, it involved more than 3,500 meeting hours, which works out apparently to about 438 working days. And of course, there's all the homework behind that, the preparation and so on. So as you can imagine, it's a very, very large project. If we can move on to the next slide. Neil mentioned that we actually thought that we needed to consult very widely and get the best possible expert view or expert views on what we were developing. So while the core expert group was 13 members, we also had an additional stakeholder group which we consulted regularly of 52 individuals from a variety of backgrounds, including, of course, industry, but also academia, regulatory authorities and patient organizations, amongst others. Please, next slide. And operationally, the project was, the expert group was split into 3 working groups across 2 distinct assessment categories. One was a proactive assessment for food production under normal conditions. So that involved looking at the supply chain and communication along the supply chain. And all the other involved looking at management within food production facilities. Then the other group is reactive assessments in response to an allergen incident, because as you know, allergens incidents do unfortunately occur, and they require risk assessment, and it's important to get that one right. Next slide, please. As I mentioned, there was a peer-reviewed publication without actually which showed the various concepts that we were exploring in the development of the guidance. Next slide, please. The practical guidance, yes, known in ILSI parlance as a black and white report for obvious reasons, had already been downloaded more than 1,170 times at the time, by the end of September, at the time of the Food Allergy Forum. No doubt more downloads have taken place since then. So next slide, please. The way that it's structures, of course, is in the form of an introduction, which actually describes and defines what QRA is and what its place in allergen management is. Then the 2 proactive streams, communication across the supply chains, including global regulatory requirements, information requirements, and how to obtain the information, which is not always as easy as it might sound. Then management of operations, which is a quantitative risk assessment within allergen control programs, and on-site and cleaning, and the management and the reactive aspect, the management of incidents, as a comprehensive guidance on how that is how we propose to deal with that. And as the document evolved, it became obvious that there were a number of core concepts which spanned the whole area, and those listed here: unintended allergens present scenarios and their characteristics, the amount of or calculation of the amount of unintended allergens present in food, guidance on food intake, of course, as part of a basic part of the risk assessment, and then some basic calculations which we added. And the annexes contain a number of examples to guide people as well. Next slide, yes. Right, okay, next slide. Right, so within the document, the document is designed for quick access to the relevant piece of guidance for that moment in time and for the particular issue that the person consulting the document has. So if we move on to the next slide, and it's yes, if we move on to the next slide again, for instance, if we look at the management of incidents, we've got the components, the incident flow chart, an assessment matrix, and a communication template, as well as examples of incidents and their assessment in the annex, which hopefully will prove useful to people. Next slide, please. The communication across the supply chain is illustrated here, for instance, through how quantitative measures are expressed, amount of a particular component within an ingredient, either in ppm or in percent. Global regulatory requirements and the differences between different jurisdictions are also illustrated. Next, please. And how the global diversity in allergen regulatory requirements, which is apparent from all the requirements, can be managed, and how you can decide that your supply chain either is a low-risk supply chain in respect of allergens or potentially a high-risk one. Next. Now, gathering information across along the supply chain is essential to actually managing the allergens within your facility. And of course, the questionnaire is a very good starting point. And this one, courtesy of the Allergen consultancy in the Netherlands, is one example of such a questionnaire. But of course, the questionnaire is only useful to the extent that it is filled in. And there are many instances that those working in the area know of questionnaires not being completed to the extent that is desired, certainly. Next slide, please. So, but there are other ways to elicit information, or at least make quantitative risk assessments, if you do not have absolutely the ideal quality of information that you would wish. For instance, you can look at nutrient information for amounts of total protein, for instance, or you can look at allergen-specific ingredients and proportions within the product, and of course, usage levels of ingredient in final product under assessment, all elements that you would want to take into account in any case. And there are sources and described and forms available on page 25 of the guidance document. Next, please. Yeah. Now we move to core concepts, and I'm not going to go into great detail, of course, of those, since Simon will be talking about them after me. But just to illustrate, for instance, there's one section on the influence of unintended allergen presence characteristics on the calculation method, and very nicely illustrates actually that just because you have the allergen in particulate form, you do not have to despair. You can move beyond that, and you can do quantitative risk assessments depending on the quality of the information available, of course. Next slide, please. There's a section devoted to sampling and analysis, which is essential, of course, to the quality of any results you get from analysis, and therefore essential to the quality of the risk assessment which you can make. And if we move to the next slide, yes, there's a very quick and simple example which actually illustrates a case of particulate contamination, in which a risk assessment has been made. But there are more sophisticated examples as well within the annex. Now, if we move on, yes. Of course, consumption, the amount of food consumed, is a very important element in the risk posed by unintended allergen presence. This particular flowchart actually guides you through how to determine the amount to be used, ideally the reference amount, but sometimes it's not always possible. Moving on from there, next slide, please. And yes, just an illustration that shows that dealing with particulate contamination does not necessarily need very high-tech machinery and so on. A simple ruler and a set of scales can be a good starting point in some circumstances. Okay, we move on to that. Now, we have had feedback, of course, lots of feedback about the guidance, and the first, well, quite abundant is, well, it's 188 pages long, perhaps with a subtitle. How do you expect us to manage to learn all that? Well, move on to the next slide. The guidance is more like a dictionary in that particular sense. You go to the part you require. You go to the where you need the information and knowledge to deal with your problem. Just as you would in a dictionary, you go to the relevant set of words for the definition. Move on. Yes, and the guidance document is designed to enable quick access to the sections needed at the time. And when we talk about quick access, it is actually just clicking on particular links, and it will take you to and from that particular element. Another feedback element of feedback received was, what reference dose should I use? Now, we don't advocate the use of any specific reference dose, whether Vital 2 or 3 or FAO, WHO or others. At the moment, we give you the choice of which set of reference doses you can use, because we're not in a position to make other recommendations there. Yes, if we move on to the next slide, which is still, yes, the guidance has been written to be globally applicable, as I think Neil mentioned, and it's been written in a way that it... Sorry? Whoops. Oh, sorry about that. Yeah.
Can everyone go on mute, please? Thank you.
Yeah. Yes. Right. So I'll continue with this intermission. Yeah, the guidance has been written in a way that it will still be relevant long after its publication, and it's intended to remain a living document. And we have put in place structures that we're thinking about exactly how to take it forward that way. But yes, it's anticipated that there will be periodic revisions at suitably frequent intervals to make it useful, to prolong it, to continue its usefulness. Okay, please. One thing that is important to stress is the purpose of this guidance document is to provide tools and approaches to harmonize the data gathering process for food allergen risk assessments. So to provide you with the tools is the important word here. It's not actually to, it will help you hopefully take a decision, but it is not intended to take a decision for you. Okay, so we move on to the next slide, I think. Oh, well, that's, thank you for your attention. I think the slide moves over to Simon now.
Thank you, René.
Myself.
Can you hear me okay?
I can hear you.
Perfect. Neil, would you, just to avoid any issues, would you advance the slides for me? So also like to extend my thanks to everyone joining us today. So as Neil said, so I work for Mondelez. I'm part of the global food safety team, and I'm also chair of the currently the chair of the food allergen task force. What I'd like to talk to you today about is core concepts, and the reason being that these core concepts will cut across every single piece of the guidance. So next slide, please. And the next one. So as René's alluded to already, you've got 4 buckets into which those core concepts sit, and they're within section 5 of the guidance. So you've got a section looking at unintended allergen presence. So both in terms of the different scenarios and the characteristics. As René alluded to, it's also about the amount of unintended allergen presence in food, because that's going to have a bearing on the reaction, the suspected reaction. It looks at intake data, so looking at different percentiles of consumption. And it also looks at the exposure assessment and the basic inputs that you would need in order to do a QRA and the calculations associated with that. Next slide, please. So in terms of the unintended allergen presence, you look at obviously the chance of occurrence or probability of occurrence, and then the root cause analysis. And what will underpin that is the form, so the physical form of the unintended allergen presence, the distribution of UAP, the frequency, and the concentration. Again, all of those will kind of come together to help you to estimate what the exposure to that unintended allergen presence would be. Next slide, please. So when we talk about cross-contamination, there are different ways to characterize it. So we talk often about homogeneous and heterogeneous, but often there's another dimension to this. So you could have homogeneous amorphous or homogeneous particulate, or you could have heterogeneous amorphous or heterogeneous particulate. And when you understand that, so if we look at a homogeneous amorphous, we say that the unintended allergen presence does have a discrete structure, and we know that it's uniformly distributed throughout the product. If we were heterogeneous amorphous, we then say, well, that we don't have a discrete structure, so it's potentially not going to be distributed. So you will potentially find it in hotspots. So one part, there may be a higher concentration, in other parts it may be lower. And what you can do, and this is, you know, built from an understanding of your process from the risk assessment, you then look at understanding what the uncertainty is associated based on the cross-contamination. So clearly, if something is heterogeneous and amorphous, it's very difficult to accurately determine that. So there's a high uncertainty. Whereas if we know, for example, that the contamination is homogeneous, so let's imagine you tipped a couple of litres of soy milk into a couple of thousand litres of cow's milk, you know that as that process moves through, that is going to be very well distributed and will give you, you know, something which will guide the sampling plan and then ultimately the risk assessment to understand what the risk is. Next slide, please. Also, as Rennie has alluded to, we got lots of really helpful flowcharts. And again, this one looks at how to do the characterization of the contamination and then potentially what calculation would be used. So, for example, if we say that the form of the unintended allergen presence is amorphous, we then ask, is it homogeneously distributed? If it is homogeneous, we then ask, is it possible to calculate protein concentration in terms of the representative milligrams per kilogram of food? And assuming that to be yes, then you would compare the calculated UAP protein concentration to a reference dose or action level. So again, there are lots of different scenarios, and the guidance is really good because it may guide you to the fact that it says, well, actually, yes, you can do a fully quantitative risk assessment, or it may be, well, because of the evidence we've got, that's going to be a qualitative risk assessment. Next slide, please. So sampling and analysis is much more than just taking a sample, sending it to a lab, getting a result and doing something with that lab. That sample, the acquisition of the sample needs to be linked to a sampling plan. So you need to look at the approach to the sampling. So how are you going to collect the samples? Is it going to be timed samples? Is it going to be, you know, composite samples? Is it going to be, samples following an allergen changeover? If it's a cleaning validation. It's about the type of test. So, for example, if we were looking to test for the presence of fish, there are very few reliable methods available to fish. So you might have to think about, is it ELISA, is it PCR, is it total protein, or is it something else? You look at the test method itself and the performance of the test method. So what is the limit of detection, limit of quantification? Has it been validated? Are there known matrices, interferences? Again, all of this is very important. And then finally, you look at performance criteria and, very importantly, the reporting. One of the issues that we see a lot of today is, particularly when we think about commercial ELISA kits, is that they have very different reporting units. So some may report as a component of the allergen. So, for example, casein from milk. Some might report as whole milk, so both the caseinates and the whey fractions, or they might be reporting in terms of the calibrant, so non-fat dairy solids. When we look at calculating reference doses, we need to know the protein, because those reference doses are based on total milligrams per kilogram of allergenic protein. We then, so with all those things considered, we then look at how do we do the interpretation. So when that certificate of analysis comes back from the lab, what can we take to that to make sure that that is part of an informed risk assessment. Next slide, please. So again, we have a flow chart for sampling and analysis. So we start with the basic question, do you actually need analytical data? And then you look at, where do those samples come from? So is it upstream? Is it supplied raw materials? Is it in-house samples? So, environmental monitoring samples, or work in progress samples, finished good samples, or if it's whether or not it's downstream, so samples of the packaged finished product. You look at the inputs. So again, looking at things like, does it have an appropriate LOQ? Does it consider, is it appropriate to composite samples, or do we need to have discrete sampling? It looks at the sample plan. So where you're going to take your samples from, how many samples you're going to take, how big are those samples going to be, and how do you then successfully get those to the laboratory for analysis. And then you look at the analytical plan. So again, confirming that you've got the right methods, that those methods are validated, and they are going to be sufficiently sensitive, so to ensure that you have an analytical result which you can input into your risk assessment. So when we talk about quantitative risk assessment, these are ordinarily the numbers or the analytical data which is generated through different sampling approaches. Next slide, please. Again, what you can do based on the information that I've already talked about, you can use that to determine how many samples you may need to test. So, for example, if it's a low level of concern, it may be that a handful, 1-2 samples might be required if it's a product without a claim. If it's medium, then that sample number increases. And then if it's a high level of concern, so if you're doing a quantification needed for risk assessment or a claim validation or to respond to an incident, then that sample size is increased. And again, there are statistical ways that we can look at this to make sure that your sampling program is representative. Next slide, please. Then we've got eating. So again, as René alluded to earlier, clearly the more of something you eat which is contaminated with an allergen, the higher the chance that there's going to be a reaction. And again, we that there are different published peer-reviewed papers out there talking about, which are the best percentile consumption numbers to use. So it might be ED50 or it might be ED75. Again, to give you something reliable. So when you think about the population at large, having a risk assessment that covers, builds conservatism into it, so that, we are maybe targeting more of the heavy users, those who consume more of the given foodstuff, rather than, the median or mean levels of consumption. Next slide. And I think that was the last one. So with that, I'll say thank you all for your attention, and handing back to Neil, I think.
Yep, thank you very much. I'm hoping that you can hear me again.
Yes, loud and clear.
Grand, brilliant. Yeah, thank you so much to both our speakers. So we now enter the second half of the meeting, which is the Q&A part. So with us today, and I can't see the list of participants from my screen where I'm sat, we have members of the task force and the expert group that were involved in developing the guidance document. So we have Jessica Cairo, Rennie and Simon, of course. We have Fleur de Mouge, Marianne van Avenhoost, Michael Walker, Si Wang, and myself. So what we'll do is, if you have questions, it's best to put them in the chat part, because it's difficult to see you. You can shout out if you like. So I'll give the floor to all of those who are present. Are there any questions in the chat? Emily, are you monitoring the chat, or Fleur?
As far as I can see, no questions in the chat, but I might be limited to not being a host. So Emily, if you could check, that would be good.
There are no questions at the moment, Neil.
Oh, okay.
No questions so far.
No questions so far. Yes.
Oh,
Okay.
Richard.
There's one hand.
Richard,
hello, this is Richard Fielder. Thank you ever so much for what is such a fantastic guidance document. I wanted to ask a question about sampling, just because when we're trying to, as we all know, when we're trying to assess the concentration of a lot, that the errors associated with that result, a large portion of them will be attributed to sampling, and then sample preparation, and then the sort of the analytical method itself. And I was just wondering, do we feel we're at a stage where we have sufficient quality of information about sampling specifically for allergens to be able to guide people, particularly when this type of work could be done by small SMEs without a subject matter expert? That's sort of, that's my question and sort of reservation. Any comments, please?
Could I suggest our lead author for the sampling and analysis? So Michael Walker, do you want to start the answer to that?
Yes. Thanks, Richard. That's a very pertinent question. First of all, there was no sampling guidance out there, which covered the range of scenarios that we encountered. There is some agricultural material sampling guidance from the Allergen Bureau, and there is a whole discipline around uncertainty of sampling, and that necessitates doing duplicate sampling exercises and then looking at the statistics of the variance of the method superimposed and distinguished from the sampling variance. But that's not something that we felt was appropriate or even practical for food businesses. It's pretty much in the research domain as yet, and I know that Charlotte Madsen is running a project on sampling for allergens. So maybe Charlotte, if you're out there, could come in on that later. So with those caveats, what we set out to do was to distinguish the easy answers from the more difficult ones. And that's why we graded the sampling advice into a variety of low concern and high concern and medium concern. And at the most complex, at the point where you have inhomogeneously distributed particulate matter, whether that's amorphous or an inamorphous, you really need to expend a fair amount of effort on sampling. And that's where it gets to look more like the sort of sampling that you carry out for mycotoxin analysis. So you take perhaps up to 100 increments across consignment, and then you bulk those. And we've given some examples of how you could bulk them in different ways if you want to retain the ability to go back to each of the increments and analyze them individually. But if you want to reduce the analytical costs, you can combine half. You can combine a half of each into a whole. So there are various different, and that's in the guidance and tells you exactly how to do it with diagrams. Then at the simpler end, maybe one or two samples will be sufficient, where you've got a good idea of the distribution. It's going to be homogeneous, and it's always going to be there in an homogeneous form. So that's where we. The other thing we did look at was where on a production line you should take the sample, and that's again not particularly complex thinking. But what we've done is we've taken some examples and then put little stars on a model production line to indicate where the most likely influence picking up cross-contamination, cross-contact might be, and where you would be more likely to find it. And the only merit that those kinds of schematics have, in my view, is that we've discussed them. There was nothing there. We dreamt up this sort of scheme. It seemed logical to us. We talked to the stakeholder group. Nobody objected. So it's a way of building your own capability and knowledge on your own production line by looking at the examples we've given. Now, getting at last to the substance of your question, do we have enough data? Do we have enough certainty? No. Is sampling variance important? Yes, of course it is. And where we're at the moment is that it's likely to be the case that there are simple situations where you're assured of the homogeneity and distribution, where a small number of samples will tell you something critical about the presence of allergens, unexpected allergens in the consignment. There are other situations where you really have to put a lot of effort in. Trends will be more important sometimes than single results. And it's, and I'll stop now, but the expectation that the more critical examination, more critical investigations will be cheap needs to be got rid of. You do need to spend time and money on sampling where you have awkward situations of poor distribution or poorly known distribution. Then, of course, you can do some kind of estimate by repeat sampling about the variance you're going to come up with, and you can combine the sampling variance and the method variance by the usual root of the variance squared. And that ultimately comes down to what bulk measurement uncertainty you're going to apply to the results you get. And I've discussed this with Richard, you and Adrian, and we all agree that in allergen analysis, that the uncertainty overall is currently much larger than you would achieve for something like heavy metal determinations. But that's the nature of where we're at the moment. And until more work is done, that's where we are. And so the takeaway messages are sometimes it's not cheap, and sometimes the overall uncertainty budget is greater than you would wish, but that's where it is at the moment. Richard, I hope that rambling answer touches some chords with you.
No, that's fantastic, Michael. Really appreciate the generous amount of time and the insightful answer, to be honest. I think, I'm trying to come to terms with, how to communicate a lot of the insightful comments you've just made, to a wider audience, and, to break down the myth that actually just buying the test kit is enough, that actually the harder part is what you've done before it, in terms of getting a meaningful result. So really appreciate all those helpful comments, and indeed the examples in here. I think that really helps spell out considerations. Thank you.
And before I leave the floor, I should also say that I see a question, a comment in the chat about the product, the matrix, the effects, the recovery, and the different test method kit specific results that can vary. And I'd commend, there's a huge amount of information in the guidance document written mainly by Marianne van Brevenhorst. And Marianne put a lot of effort into the most comprehensive overall summary of how to do allergen analysis that I've ever seen. So that part of in fact, maybe if I could hand over to Marianne to discuss that aspect, because the remark, I don't know where it came from in the chat too, but whoever put that in, that good sampling without good analysis is not the answer. Good analysis is vital. And maybe do you want to take over, Marianne, from there?
Yeah, thank you, Michael, for your kind words. But indeed, all other aspects when performing analysis are very important. So it's a combination of sampling, performing the analysis, but also choosing the right method for the right matrix is extremely important. Extraction methods, and this guidance is focusing on food business operators, so not laboratory. So we didn't address all aspects which are important to obtain a relevant and meaningful result of analysis, but there are many.
Marianne. Rene, did you want to say something? I noticed you put your camera back on.
Oh, I wasn't planning to, but
okay, sorry.
but I'll say it anyway, because I was just having a thought actually, following Marianne's comment actually, that yes, it's important in fact, and I think we do recommend in the guidance a very good dialogue. Obviously, having made an appropriate choice of analytical lab, it's very important to have a good dialogue actually with them as to the requirements and the expectations as well in terms of delivery. I mean, we don't just want a certificate of analysis saying below level of detection and nothing else, possibly not even the test method indicated or anything. And I've seen many of those in my professional life too.
Good dialogue with the lab.
Definitely a dialogue with the lab. I think, again, thinking about this from a manufacturing perspective, so we often talk about a risk-based approach. So depending on, let's imagine you're making a positive claim, so a free-from claim on a finished product, then clearly the level of risk associated with that would be much higher than if you were doing, sort of the qualification of a regular supplier. And again, where the sample numbers would be low, if not at all. Again, thinking about what raw materials your suppliers are actually also handling on site to kind of guide where you might want to direct testing, because it's somewhat meaningless to test everything for everything. So it's thinking about your own manufacturing facility, thinking about what potentially you're going to be putting on the labels, whether or not there's an incident. Because clearly, if you have a known contamination, the sample number will become, just by its very nature, much higher. So using that same kind of rationale, which is which is inherently built into this guidance, just to help think, what am I actually dealing with today? Why do I need the data? And then being guided to say, well, this is potentially the samples, this is the dialogue with the laboratory, because that is so important. Lots of different methods out there, lots of different labs. Unfortunately, not all are equal. So having the conversation with the lab is really important.
Yeah, thank you. Oh, sorry,
Neil,
Michael,
sorry, I missed what I just scrolled up, and it was Andreas who put the remark in about good analysis. So thank you, Andreas. The other thing to follow on from what Simon and Rene have said about dialogue is to remember that you, the food manufacturer, food producer, will know much more than about your product than the laboratory does. And so being open about what's in there and what might have gone wrong in the factory with the laboratory is important. But equally important is for the laboratory to be open about what might have gone wrong their end if you get an odd result. And providing matrix samples to the laboratory so that they can spike them, so that they compositional details that will help the laboratory to give you a better service. Then the next thing to say again is about budget, because you may be accustomed to getting microbiological analysis done for less than €10. You're not going to get allergen analysis done properly for that kind of figure as yet. And it's a mistake to try and drive the price down. I am an analytical chemist by background. I don't make money from doing analytical chemistry. I only make money about writing reports. But so I would say that, wouldn't I? But the fact remains that you get what you pay for. And I've seen examples where shortcuts are taken and the end result, as you would expect, is not good. Then if you've got a really difficult situation to deal with, you do need to do more than one analytical approach. And if it's ELISAs, more than one antibody preference. You may also need to think about doing PCR for the DNA, and what will that mean, or ILSI MSMS for more precise information about the protein. And the really good thing that I've seen coming now is that I can see laboratories much more than they used to reporting measurement uncertainty for allergen analysis. I haven't seen much in the way of recovery correction or whether or not recovery's been carried out. That's maybe the next thing. And I don't see a great deal about use of reference materials. So those are the downsides. The upsides are AOAC, as most of you will know, and if Adrian Adrian and Richard, they have been part of this AOAC effort. What's just been publicly consulted on is quite a comprehensive document on how manufacturers of test kits, ELISA test kits, should validate that their test kit methods. And that's much more sophisticated guidance than was available in the past. Hopefully, AOAC will go on to do the same piece of work for end users, and that will mop up quite a few unanswered questions and will start to corral people into the same channel of good practice that the AOAC good practice guidance for validation of test kits by their users hopefully will engender. And that working group has had all the major test kit producers on board. So they have all argued, debated, sometimes with sometimes some very, very hot and heavy debates, but the consensus is there now, and it's out. It was out for consultation. currently we're going through the consultation responses, and then it'll be published as a full-blown AOAC guidance document. And if you're out there, Adrian, do you know if that guidance document will be behind a paywall when it's finally published? Or Richard, maybe you could answer that.
Hi, Michael. Can you hear me?
Yep, go ahead.
Okay, brilliant. So, I'm not sure what they're going to do with it, because usually you register as an AOAC member and you get access to the methods database, and you get access to the Journal of AOAC. So I think AOAC members will get access. Further than that, I'm not entirely sure whether, because I mean the Appendix M as was published as a final paper as well, but I'm not too sure what the intention is from that. We can ask. It's the next meeting's tomorrow night, so we can certainly ask about that.
Yeah, and that would be a good thing to put on the community of practice that Simon's running. So Simon, keep us in mind about that.
Okay.
I see a question in about LOQ.
So sorry, like just a follow-up question there, Michael. You mentioned that there might be a guidance for end users, so presumably validation of different matrices. Is that something that's been discussed at AOAC? Is it likely to come?
Oh, for the producers, there's a whole section on matrices, and a lot of good solid guidance there. And that if it gets to the point where there's sufficient appetite within AOAC to move on to an end user guidance document, then it will cover that kind of question, Neil. And I really do hope that AOAC bite that bullet. I will keep you posted.
Great, thanks. So yeah, definitely support that. So there are members of the food industry who would support that. So yeah, thank you. Just to also add, in terms of that issue of uncertainty, within the incidents section of the guidance document, there is a relatively crude attempt to capture the uncertainty associated with sampling and analysis. Perhaps in a future version of the guidance, we could further elaborate that and introduce it as a wider context. But it seems to have met reasonable success in terms of what we've done in terms of training around the incident part. So understanding the uncertainty associated with an evaluation when you're dealing with an allergen incident, when there's something that is potentially present that wasn't previously accounted for. So there is some kind of, yeah. So it'd be good to, if you looked at that, and Richard, Andreas, and maybe fed back on how you thought that relatively simple approach could be applied wider, perhaps. But yeah, thank you very much. Before we get into the next one, there was another question from Carolina Moto. Was that what you were going to get to then, Michael? Sorry.
There's a no. Go ahead. That's a different question. I'll come back to the other. Yeah, please do address Carolina's. It's not an analysis question. I'll come back to the others that I'm
okay, so a bit of variation, and I suspect this is one that that Rene, you've dealt with many times in the past. So the question from Carolina concerns, well, does the ILSI task force have a recommendation in terms of reference dose? Should it be based on the EDO5 or should it be based on the EDO1?
I was going to put something in the chat about that, but I'm glad you raised it actually, so that everyone can hear it there. No, as I think I mentioned in the slides, in fact, we do not make a recommendation in terms of which reference dose to use for the risk assessment, because the area is in a state of flux at the moment. I mean, I don't know whether it's but I mean, even the Allergen Bureau looking to harmonise with FAO, among others. So, which would be an ED05 reference dose derived. No, a reference dose derived based on the ED05. But no, we kept away from that particular thing because it's still an area which is in flux. Of course, the codex process still has a certain amount of time to run. Difficult to say exactly how long it will be. There are meetings planned in 2024, for both the CCFH and CCFL, as well as the Codex Committee as well itself. Maybe, but we're not sure exactly how far the decisions will go that way. So I think once the area is stabilized, it will be possible, but people can still use that, still use the reference doses and look at it. And the reference doses are available on the Excel spreadsheet associated with the guidance.
Yeah, thank you, René.
Yeah, and maybe good to stress that now the part 5 of the FHO-WHO report is there. Also, the Excel file will be adjusted accordingly, and there you can find all the reference dose sets which are out there at the moment. So, and maybe also to build a bridge to the questions on analysis, this tool will also help you to perform a risk assessment without any analysis, because we know sometimes analysis is not possible or the results are, well, not really reliable, and it's possible to perform a quantitative risk assessment without any analysis, just based on particular size, weight, or the amount of hang-ups and batch sizes. So this tool, I think, is really important to have a look at and download it from the website of ILSI.
Yeah, in my experience, there's many more QRA formed that don't include actual analytical data. So reverse QRA, for example. So how much of a hang-up would you actually need to cause a risk, and is that theoretically possible? Those sorts of questions are really important in terms of, you know, potential cross contacts that might have happened or may not have happened. Yeah. Thank you, Marianne. So, Michael, there's a couple of questions there now on analysis as well that you were getting to, right, before I rudely interrupted you. So.
No. It was good of you. You're the moderator. You gotta keep bringing the changes. So, to comment though back on what René was saying, while we're in this state of flux, it's more important than ever to be transparent about what ED05 or ED01, which of them you, or another metric, somewhere in between, what you applied. And so if you're talking about a risk assessment, which is trying to decide whether or not you apply a cautionary allergen label, then you need to be transparent about that the risk assessment has been carried out, and then how it's been done, and what reference dose and portions, what reference dose and what intake, food intake size has been chosen. So transparency is the answer at the moment until there's consensus on whether ED01 or ED05 is appropriate. The other thing, going back to sampling and the results that you might get, the other caveat that comes out very, very much from the guidance, and this is something, Neil, that I was very impressed that you put in, was some data on the results that you're liable to see emerging in an incident. And those results were far from coherent, very realistic. So you might get, from memory, you might get a series of results 0, 0, less than LOQ, less than LOQ, 50, 80 milligrams per kilogram as the allergen protein. But what one are you going to pick when you've got such a wide range of seemingly irreconcilable data? The guidance says you pick the worst case. And that means that you are doing the most conservative risk assessment. And anything else would be difficult to defend. If there's no reason to reject any of that wide spread of data, and that's not untypical in real life, then you take the worst case scenario. Neil, you authored that bit, and it is, I hope I've captured your sentiments.
Yep.
I see a nod. Okay, going down to something else that Andreas mentioned about a robust LOQ, and not as low as is senselessly achievable. So that's very, very appropriate. It's a truism that LOQs, LODs, decision limits all of those things are not at the foremost of laboratories' minds. And that's because they can change over time. They can change from operator to operator, instrument to instrument, even though you're using the same method. They can certainly change with the matrix, with the extractability, with all sorts of issues. So it's a problem for laboratories to talk about an LOQ and have it something that they can publish, and it's going to be the same this month, next year. So it doesn't often get the attention it deserves. And back in the mind, it's like your measurement uncertainty is probably always going to be more than you think it is. Your LOQ is going to be higher than you would wish. And so your plea for a sensible LOQ, and that's one that is based on, for chromatography, you've got a spike. For spectrophotometry or some of the other methods, you don't need to spike. You can see the variance around the zero, the blank, and use that. But for chromatography, you need, that's LCM, SMS, you do need to spike. So essentially, you're looking at the variance of a near to blank sample with a sufficient number of replicate determinations carried right through the analysis. And then for the LOD, it's that variance times 3, LOQ, that variance times 10. If you look at if you go back to the Eurochem guidance from 2014, it's all set out in there with examples, and very much echo Andreas' plea for a realistic LOQ rather than something that you might, rather than wishful thinking on the part of the method developer. The next one then is from Kumail. This is interesting, about a range of specific proteins from an allergen. What Kumail means by this is, instead of doing measuring what we do at the moment, which is the total protein from the allergenic source in milligrams per kilogram as protein. What's possible to do in certain circumstances is, if you're doing peanut, you can measure the molecule RH2, RH6, any of the specific protein molecules which elicit allergies in susceptible, sensitized people. And remember that people will maybe react to RH6, but not to RH2, and vice versa. So not many people at the moment are making use of the ability to measure the specific allergen proteins that go to make up the totality of the allergenic protein in the food product. It's mostly done in diagnostic and clinical laboratories for diagnostic purposes, not of the food, but of the degree to which the sera of patients react to each of the individual molecules. I currently don't see it having a relevance to routine allergen measurement, other than, for example, the very straightforward cases in that if your target population is allergic to casein, but not to beta-lactoglobulin, or the other way around, you've got to make sure that your method measures the relevant specific protein. But other than that, Marianne, you may have other examples. The milk one is well known, but there may be other examples with around egg and some of the tree nuts. Do you want to come in there?
Yeah, there are more examples, especially when we're trying to detect derivatives of specific allergic ingredients. Then it's hard to detect an allergen when a specific target protein is not there. For example, trying to detect soy in soy lecithin is quite hard. There is a underestimation of the amount of soy in soy lecithin, and we've done also some work with Comain on this. So I think this is relevant, especially for derivatives. But maybe there are more examples out there.
Comain, I assumed I made an assumption about what your question meant, but maybe do you want to come in and comment on the answers?
Gosh, I wasn't prepared on speaking. I think Marianne's, Michael, you were in the ballpark. I think Marianne understands a little bit more where I'm coming from. So I think there's a few scenarios where that comes into play, and where it is often, if the reference dose information was linked to specific allergenic proteins, like Michael, you've mentioned the ARA1 and ARA6 examples, then it would be wonderful to have that additional information in terms of which allergens were detected at which concentrations. So I guess that was where my question was going. But to link to the more immediate presence with the derivatives, as Mariana has said, it is important to understand which derivatives are present, because we often see, for example, that only casein is present with a little bit of whey, for example, when we use our LCMS methods. And I guess the question then is, if you start doing quantitative, one of the questions that I've had, and Mariana, I might have discussed this with you in the past and forgotten, but if you, for example, tested a sample for milk and you're going to base your quantitative risk assessment only on that one sample, so let's assume that, and you've only tested casein, or you've only detected casein, would you then use the casein result, or would you assume that that casein is from a whole milk source, if that makes sense, because it does make a difference in terms of how it corresponds with the reference dose. I hope that question and comment makes sense.
That's very, very sensible and a very good question. This is going back to what I said about the food manufacturer in forming the laboratory. So you'll know the degree of segregation, separation that you're doing to, or at least hopefully you'll know the degree to which you're separating the various components. And you need to tell the laboratory that it's no use looking for casein because it ain't there, because that's being diverted to another product stream. You're only going to get beta-lactoglobulin. But if you know you're only looking for beta-lactoglobulin, then it's over to Rene. There is no reference dose for beta-lactoglobulin. The reference doses are for milk. We do know, and we can make a good guess at the amount of beta-lactoglobulin in the clinical studies that were used to derive the reference doses for milk. And so it is possible, if you know what's in the sample, if you know what your ELISA or your other method detects, it's possible to convert from what you've measured to the likely total milk protein in the sample. And then that gets you through to the reference dose.
That's exactly what I said, Michael. Actually, yes, that is absolutely right. You can work it out from there, actually. It's when, I mean, I know from experience, actually, it's when you have heterogeneous mixes of milk and some other component of milk that you get some strange thing. Those occur certainly from my experience, at least in ice cream, for instance. But there are possibly other products where they do, and that makes analysis and the interpretation of analysis is quite complicated. In fact, I think the only time I had to deal with it, we made up a different standard, which is based on the relative proportions. But yeah. Of course, if you're having it done at an analytical laboratory, you'd have to tell them that was how it should be done as well.
Yeah. But I think the main question here is, what conversion factor do we need to apply, and do we need to apply a conversion factor? Because, for example, egg, as another example, if there is only egg yolk in a product, we cannot detect it with ILSI because it's targeting on egg white. So there's a detection issue, but if we are capable to detect egg yolk, what reference dose do we need to compare it with? Because it's egg yolk, it's not the whole egg which is used there. So in writing the guidance, we have discussed this topic, which is very, very complicated in terms like protein equivalence. But I think this is an area to further develop guidance, especially for the derivatives which only contain specific proteins. Can we convert it to the total protein of an allergic ingredient or not? Because it's not the same.
Yeah, I think we probably need to reconvene sometime and do some example calculations on that basis. That'd be a good thing for a rainy day.
So we are starting to run a little bit short on time. Adrian, you've got a yellow hand up.
Yeah, sorry, it was just to chime in there, and it's going back to the fact that you've got to make sure your method analysis is fit for purpose, and it's fit for the purpose that the end user wants it to do. So this is what we're saying about having the conversation with your laboratory, but also possible to supply the potential contaminant, so the allergen of interest, and that way, especially when it comes down to processing, because there's going to be a difference between the detection of the processed foods. So if you can supply that processed allergen to the laboratory, they can do some work with that to determine maybe a correction factor, because it could be they could only recover 25% of what's there, but at least you've got that knowledge going forwards that the method of analysis can only detect 25% of the total allergen that's there or something. So it's another bit of information. And this is why we say about how important it is to have that dialogue with the laboratory, and also then back onto the kit manufacturer as well.
And just to perhaps bottom that out, how many allergic consumers do you think have an awareness of what derivative or what fraction of a particular allergen source that they are sensitized to? So for example, are milk allergic consumers aware to some degree, or are some degree of them aware that they're either allergic to the whey or the curd, or is that knowledge?
I mean, it's a bit of a contentious thing, but going back to what we heard from the FDA recently about the skin prick extracts, people don't even know what's in the skin prick extracts at the moment. So there's a lot of work to do, but I can't. It would be up to someone else to comment on the clinical aspects of it, I think. But that's just something that's stuck in my mind. You know, that the skin prick extracts, they don't know what's in there yet.
Okay, great. Thank you very much. So we've got just a few minutes left. So if there's another quick question, we could maybe handle it. I think we've covered all in the chat. So maybe we go back to the slides now. And just finish off. So in terms of next steps, well, the next steps with the practical guidance are to disseminate it, and that's partly what this has been about, but more importantly has been about starting to develop that community of practice, because this is a first version of the guidance, and as you've heard a couple of times, it needs to be trialed more, it needs to have developed in certain areas a bit more. So we need your help in terms of application and feedback within that community of practice, so that we can improve and update the guidance. And this is really important, not just from a, obviously the priority concern is the allergic consumer safety and understanding of when precautionary labeling is actually based on risk and when it isn't, or what it means for them. But also because there is an emerging authoritative expectation that food business operators will be mindful and be using these approaches. So, and then in terms of ILSI, of course, the ILSI task force has a number of activities going on at any particular time, and some related activities that are just getting going at the moment are on, well, what are the barriers to PAL regulation, and what can we do about establishing a threshold of allergological concern related to sensitization. And that's a follow-up of work which is about to be published actually, that René presented on recently, the Food Allergy Forum, on the assessment of novel proteins or established proteins being used in new ways in the food chain. Community of practice. So if you haven't done so already, or you're not aware of it, please go to this LinkedIn group. Details are here. So Quantitative Allergen Risk Assessment Group. What we want to do, what we need to do really to further develop the guidance and solidify that consensus amongst food business operators is get your input, and also there's an opportunity there in terms of tricky situations, tricky questions that you may be dealing with, is to get input from the wider community, including those that have been very much involved in the development of the guidance. So, and that is the end of the webinar. We're exactly on time. So thank you so much for everybody for attending. I hope it was useful to everybody. It was certainly useful to me. So thank you very much.
Brilliant. Thank you all.
Thanks, everybody. Good to see you all again.
Thank you for your presentations. Bye-bye.
Take care. Bye.